Okay. Um, I'm a teacher sort of guy. I taught junior high school before going to medical school because teaching junior high was much too hard. It was really difficult. And so I wanted to do something that the skill that I was pretty sure I could master. And being a doctor, this is a dirty little secret. This I worry about getting out in the recording. It isn't that hard to be a doctor. You just have to get on the merry-go-round in medical school, and Zachary, you'll be getting on, but everybody else here knows. You get on the merry-go-round and then you work your fanny off doing what they tell you. And all you have to do is do what they tell you, and you'll come out the other end a doctor. And then being a doctor, that's something else again. I mean, if you just want to make a diagnosis and use some protocol-driven thing and using some creativity to come up with a treatment plan, that actually is pretty easy too. The hard part is doing that integrating work of thinking broadly about who the patients are and how their illness um, is a part of who they are and how your work with them is going to change them and you. Um, so part of my background is that I came up during the civil rights era and the anti-Vietnam War era, or as the people in Vietnam will say, the American War. Um, we think of things from our own perspective. We call it the Vietnam War, but they, quite rightly, they fought war. A series of people who tried to invade them, and ours was just one of them. Um, and I was what was called a conscientious objector to the draft, and so I refused to serve. And because of that, I've always had a strong pull to veterans, people in my high school class who went and some of whom did not come back from Vietnam. Um, Not one, actually. Um, but I've always been interested in these people who did agree to go, usually out of patriotism, sometimes because they were poor and it was a really good job that promised them, sometimes um, um, without the promise coming true, a skill set when they completed their tour of service. And almost everybody gets hurt. There's a lot of trauma being a soldier, seaman, Marine, or even a Coast Guard's person. Um, the process of being in the service is very traumatic. Now, it doesn't mean everybody has PTSD, but everybody's been traumatized. I'm also the son of a Holocaust survivor. Um, my father escaped Nazi Austria at the very beginning of the war, of World War II. And I've known many Holocaust survivors. All of them have been traumatized. Some of them have PTSD. So I've always been interested in veterans. And when I returned from my gig at the City University of New York Medical School, back up here to northern New England, I decided to finish out my career at the VA so I could spend that time with veterans. And I'm very, very glad that I did. I had an amazing time working with these men and women, um, most of whom had no idea what they were getting into when they signed up. Um, but all of them came out having been exposed to a lot of forces and a lot of stresses. So I'm going to go to my PowerPoint now, if I may. And which one of you is the administrator or the nobody?
I'm the host, but Zachary is the moderator.
Okay. And I guess I was thinking, yeah, Natasha, you'd be the host because it's a drexel.edu Zoom, I noticed. Okay. Yeah, I just want to make sure that I can share. Let's
Let me know if
see.
you have any problems.
Okay. Um, so tell me, oh, stop that. Being recorded. I know I'm being recorded. Da-da. Okay. Can you see me? Can you see the slides? Okay. So this is usually a talk that or a discussion that we've had a number of times for the internship Oh, and let me just step back a second here and say that I also know Dr. Ken Dolkart, who you guys know. He and I are both very active in the New Hampshire chapter of Physicians for a National Health Program. Um, and so I've been giving this talk or talking with interns for many years. And my co-presenter is Suzanne Gordon, who is the single most knowledgeable person about veterans healthcare policy in the United States that I know of. Um, and she has written a couple of books that I'll tell you about. She started this organization called the Veterans Healthcare Policy Institute. Um, and she is brilliant. She also is phenomenally busy. And all of a sudden, at the last minute today, she had to go and take care of her grandchildren. So she is going to sign on at about 2 o'clock. And I'm going to basically set the stage by telling you a little bit about the strengths of the VA and the risks that it faces. And I'll be giving a little bit more of the history of the risks that it faces. And then when she signs on, she will give us the current skinny on what is most pressing. Um, so here's the discussion. What do you think of when we say the VA? What phrases, images, or words come to mind? And I want you to just call out. If I was really clever, I would do one of those word clouds as you type them in. But I'm not a zoomy enough person to be able to figure out how to do that. But why don't you call these out? And I recognize the fact, by the way, that probably none of you has done a rotation yet at the VA. Um, so you may not have had very much experience, but my guess is you have some ideas about the VA from whichever communities you're from, your family, or from reading the newspaper. So what do you think of when we say the VA?
I can go first. I haven't done a rotation formally with the VA, but I did have a clinical preceptorship. I shadowed an ER doctor at the VA here in Atlanta,
Hmm.
which was really cool. But I think of the VA as a hospital system that serves um, veterans, and I think it used to be family members as well, and now no longer.
Yeah, the answer is you can get a family member covered under if you are 100% disabled from
Mm,
a service connection, and
mm,
if your spouse or children do not have other coverage.
mm.
Other things that's what it is. What what feelings or impressions do you all have of the VA? Is it good? Is it bad? Is it inclusive? Is it um, um, a source of waste, fraud, and abuse, as they like to say?
Personally, just from veterans in my life, it's maybe not the most efficient. Maybe lots of barriers to accessing care or like getting things done. Maybe takes longer. I don't know if that's more recent though.
Inefficient and bureaucratic. Yeah.
Yes.
Hey, during COVID, I was doing telehealth for the VA, and somebody discovered that I was out of date on my basic life support, my BLS. Um, and they said I had to stop doing telehealth until I got certified, um, which I thought was pretty funny. I mean, if one of my vets had an MI on the other end of the video, um, my lack of certification was not going to have an impact on their health. Talk about bureaucracy. What other uh, thoughts do you have about the VA?
I don't have personal experience or working there or knowledge about the VA, but I have heard that it is a great place to work as a doctor or healthcare professional.
Any idea what makes it good?
Something that about that you have a lot more freedom to whatever you as the physician think your patient needs, you can get that ordered without a lot of bureaucratic, hurdles to jump over.
That's exactly right. There are no, but almost no prior authorizations. which, as you probably know, is a huge bugaboo with Medicare Advantage and many managed plans, such as in accountable care organizations. I will tell you that I loved working there, mostly because of the morale. When I was thinking about going back to practice at Dartmouth, I went to the VA and I was just wandering around. A pal of mine said I should check it out, and I saw this guy. Looked like an interesting guy wearing a maintenance guy's shirt in the on the hallway, and I stopped to talk to him, and I said, "So what do you do?" Maintenance guy, right? I said, "What do you do?" And he said, "Oh, I help take care of our veterans," which I thought was just awesome. Um, that would have been like one of you guys when I said, well, "What are you interested in?" You would answer, "I want to take fantastic care of my patients when I'm done with my training. That's what I do." You know, so that I said, I want to work in a place where that has that kind of atmosphere. What else do we have?
I've heard it's underfunded, but I'm not exactly sure. I
Oh
don't have
boy.
personal experience.
Oh boy. Okay. Yes, you're going to hear a lot more about underfunded. Um, and yes, you're right. And I'm hoping that some of you have also been keeping track of the in the news. Have you? Did anybody remember what the name is of the secretary for the VA? Anybody? Anybody? The guy's name is Collins. He's a and he put one over on the senators when they confirmed him. Um, because he said he would not further underfund the VA, and he's proceeded to do just that. Um, so you might have read about him and others that are in the news. Okay, I don't want to belabor this too much, but let me just ask if there's anybody else who's got something they want to say um, that they think about with the VA. So we have inefficient. How about go
I
ahead.
think Caitlin, just Caitlin's raising her hand.
Go,
Hi,
Kate.
I had something to say. I think, well, for the Rowan people, we started about 2 weeks ago. So last week we had a speaker kind of bring up briefly some current events that's happening with the VA. And so I'm not sure of the current status of it, but as of last week we kind of talked about them changing their bylaws. And there were some claims saying, well, I have it pulled up, but apparently the VA changed their bylaws, and it used to say that they should not discriminate based on race, age, color, sex, religion, national origin, politics, marital status, or disability in any employment matter or in providing benefits under any law administered by VA. But apparently the bylaws have been revised and now eliminate um, politics and marital status, um, making some people believe that now at the VA they can discriminate and not treat you based on if you're a Democrat or if you're unmarried, and that the VA has kind of denied it, but also kind of not denied it by saying that more using selective language, I guess, and they're just saying, oh, the VA will always provide healthcare for eligible veterans, but not explicitly denying those claims. So I'm not sure where it currently stands, but that's kind of what I think of because it's in the current news.
Caitlin, I think you're right on top of it, and that just upset the heck out of me when I heard that. There's a companion change in the rules that they said that in hiring that they cannot discriminate, and they similarly took out they from their hiring that they could not remove the clause they could not discriminate on the basis of marital status or politics. Um, so now, if you are somebody who's seen as being against the politics of the VA, and every VA has a huge portrait of whoever the president is when you go in the main door of every VA. I don't know whether you saw that at in the Atlanta VA and I don't know when you went in there, but so somehow the politics of the VA might be conflated to be the politics of Trump, or they might be, as you say, we don't really know. There's some weird stuff going on with the sense of governance. Who is in charge? And this is just like any other national agency. How much of it is going to be guided by the politics of the current administration? And it is frightening to all of us. Are there other things? So that's sort of uncertain future. I'm writing that down, Caitlin. Okay, well, let's go back to, ooh, can I do this? What are you guys seeing right now? Are you seeing people's faces or are you seeing my PowerPoint?
We can still see your PowerPoint. It's on the let's start with a question for you.
Okay, good. Well, somehow I'm not seeing the darn PowerPoint. I've changed my settings so that I could see all of you and now I can't get back. Let me try that. No.
Do you
Multi-speaker.
see like a view option in the upper right corner of the screen,
Yeah.
maybe?
Yeah, I
If you click
can.
on that, is there a view that will allow you to see your screen?
Short answer is no. That's why I've been clicking on all of those, all those. So I'm going to stop sharing and then start sharing again with apologies, rather than wasting too much time. Okay. So for those of you that are really tired and you just had lunch, here's the summary. And then I'll go back over each of these in some detail and then get ready for Suzanne to come. But the VHA, which stands for Veterans Health Administration, different from the VBA, which is the Veterans Benefits Administration. It's a unique model of healthcare delivery. It takes care of a very vulnerable segment of the population. Its incentives are entirely different from the U.S. insurance system, which even in nonprofit systems, I mean, each one of your medical schools, I think, no, is Rowan for-profit or nonprofit? There are a couple of for-profit ones in there. Does anybody know? I think Rowan is nonprofit. And I'm pretty sure that all the rest of yours are nonprofit. Anyway, even nonprofit healthcare systems are guided by the for-profit system. The VA is not. The VA is under dire threat from forces that are trying to privatize it. And any of us who are advocates for a rational and compassionate healthcare system should pay close attention to what's going on at the VA because privatization there leads to privatization everywhere. So I guess it was Alana again who said that the mission of the VA is to take care of veterans. That is entirely true. And it's one of only 4 missions of the VA. The other 3, and this is written into it, one of them is to teach. And most of you are going to end up having a rotation at the VA, either in medical school or as a resident or both. Number 3, it is a research institution with a lot of, you've been keeping up with a nosology, R01 grants from NIH. So the decrease in funding of the NIH has been dramatic, but we also have access to other funds for research. I did a research project half funded by the VA looking at the impact of veterans who got their care half in the VA and half out in community settings. And you probably have seen that, or you will see that. And that was a piece of funded research that resulted in a peer-reviewed publication. The 4th mission, and this most of us did not know, but I didn't know about this until the pandemic. but the VA is available to the civilian system when there's a national emergency. And during the pandemic, a number of us, not I, but a number of my colleagues, were posted. They were, as a Veterans Administration, they were asked to go to New York City to help because of the dire impact of pandemic on healthcare and the community in New York City. And they didn't just go to the VA, but they went to NYU, Bellevue, Brookdale, Bronx, Lebanon, Jacoby. I don't think they went to the Staten Island hospital, but they did go to hospitals in each of the other four counties of New York City. So it's an important fourth mission. And so, what Zach, if you Zachary, sorry, if you could keep your eye on either people raising their hand, I'm going to sort of just plow right through. Very good, thank you. So, the value of the VHA to the country is that the research benefits all of us. I could find dozens of cases where both foundational and translational research was done at the VA that then was disseminated to the entire healthcare system. The teaching is important. We are a model of what the rest of the American healthcare system does poorly. And I'll be saying in just a minute that the key part of that is that we work as a team more effectively than in any other system I've worked. And that's because the profit motive is gone for siloing. When I practiced at the VA, I could call the radiologist and run down and have the radiologist review an x-ray for me. They always were available to help me understand an x-ray results that one of my patients, or to talk me through figuring out which procedure. The pharmacist on my team was always available so that if I was worried about drug-drug interactions or polypharmacy, often the pharmacist would be rounding with our inpatients team, but as an outpatient doctor, I could reach them. More importantly, all of our primary care teams had a nurse case manager always on the team, as well as a medical assistant, so that we would huddle every day and plan for that day's care and coordinate both their in-house care and then their follow-up care. And the thing that was so cool is that mental health was just downstairs. All of you probably know, even if you haven't experienced it, that some large portion of patients in primary care either have anxiety, depression, or major mental illness as one of their diagnoses, or their other diagnosis results in potential anxiety or stress. Let's say you have diabetes or cancer. These are very stressful conditions to deal with. And for all of these, if I need help from a psychologist or a psychiatrist, I would literally take the vet by the arm, walk them downstairs, go to the psych desk, the mental health desk, and say, "Hi, this vet needs to see somebody right now." And they might have to wait for an hour, but they were structured for that soft handoff. Nursing home care, I wish it was better. It is high quality, but there aren't enough VA nursing homes. But those that there are terrific, and they're often called soldiers' homes. In a number of studies, there are far fewer disparities based on gender, including trans care, on ethnicity, or age than the civilian system when studied in a large number of settings. And whichever one of you spoke about the inefficiency and the bureaucracy, I guess that might have been you, Zachary, and the fact that we're underfunded. All of those things are true. But despite that, we managed to have care that is more equitable. So when resources are tight rather, they do not go preferentially to the people with the best insurance. They're distributed fairly. Um, and this is just one example of one of the studies that showed a 46% reduction in mortality if a patient is treated in a VA hospital. If we do have time later, we can talk about what you need to be in order to be eligible for care at the VA. These are these are sound bites, but there are a number of studies from high quality journals. And all of you know, I'm sure you've studied the basis of evidence-based medicine to know what a high quality study is. The fact that the New England Journal and JAMA accept the study doesn't guarantee that it's high quality, but increases the likelihood that the peer review has been very, very rigorous. I review papers, and it's hard to review papers, but these New England Journal and JAMA have statisticians on staff who make sure that it's all that the conclusions are apt and appropriate. So, and you notice it says men. Something like 90% of the people treated in the VA are men, which matches the percentage of gender in the population. I'm trying to remember. I just read the number of trans folk there are in the VA system, and with apologies, I can't remember precisely, but I think it was 6,000 to 7,000. But I might be off by a digit. It might have been 16. So if any of you know that or are have Google at your disposal where I don't, please put it in the chat. So this slide just reinforces what I said before about teamwork and multidisciplinary interprofessional care. So how is it that we can do this? Well, if you look at the bottom line, the reason is that we are socialized medicine. And that means that not only is the payment all from one place, single payer, and most of us in PNHP and in SNAP, but somebody remind me, because I want to ask you guys later, how many of you have SNAP chapters? Just out of curiosity. But it means not only that it's a single source of payment, but also that the people that provide the care are employed by the system. So the VA is the only, actually, that's not correct. The correctional system also sometimes is socialized. And if any of you are interested in carceral health, we perhaps can talk about that at another time. And let me ask you, is there a session on carceral health for this internship?
Most years there has been.
Okay.
I
Thank you.
think Marvin's still looking for a response.
Okay. Thank you, Betty. I didn't realize that you were still with us. That's terrific. So if I say something that I shouldn't, please signal Zach and he'll tell me.
I
'Cause I
popped
can't-
back on so I could hear any new stuff with all the federal cuts and stuff.
You'll hear that at the end from Suzanne. Not so much from me. So we all work on salary. Now, the people who are opposed to fee for service say that when doctors are paid for doing each item, that there's an incentive to overtreat. And the people who are critics of managed care say that there's an incentive to undertreat because the system would have more money in it if we deny care. It is an interesting debate for those of you who are high school or college debaters about which one of those incentives is worse, incentive to overtreat or the incentive to undertreat. I would say in my experience, they both are dangerous. And that's why I stress the importance for all of you on being ethical and compassionate doctors, because then that will be your North Star rather than the money you're making, or the money that the system is going to make. So that's the main reason why we do so well. One of the others is that, unlike health insurance companies, when they're paying for stuff, they have an incentive to postpone treatment, because eventually you'll be off of their insurance rolls, and then the next insurer, up to and including Medicare, will be the one to pay for care. So this is one of the arguments that, one of the reasons that some studies found why some systems don't do enough mammograms. Because if you don't do a mammogram, you won't find the breast cancer. Now, this doesn't answer the question about whether or not all early documented breast cancers should be treated at the moment that they're found, particularly for DCIS, ductal, intraductal carcinoma. But because we take care of people, and for the rest of this talk, when I say we, I'm going to identify with my VA hat, we take care of everybody over their entire lifetime. We don't put off to the next insurer. The other is that we formed this wonderful community of mission-driven folk. Again, the maintenance guy saying, I take care of my patients. And I've known countless VA patients who love coming to the VA and being in the waiting room because they connect. If you've been in a waiting room, when you go to see your doctor, you will not find people talking to each other. In a VA waiting room, the veterans talk to each other. They say, where were you? Which outfit were you in? How were the officers? How was the post cafeteria? And they, for the most part, enjoy being in the waiting room. The VA was the earliest adopter that I know of for telehealth, and one of the earliest for simulation. I know that at the Geisel Medical School at Dartmouth, where I teach, we have even less patient contact in years 1 and 2 than we used to, and a lot more time in the sim lab. And so some of you whose faces I can see, either nod or raise your hand and say yes if there's a lot of time in the sim lab. No, I don't see very much time in the sim lab. Okay, you guys are better off than the Geisel students who spend too much time in the sim lab. But the VA has done a lot of work with simulation. The pandemic was an interesting case study, and it has been written about a lot, about some of the strengths of the VA. Some of these bulleted items were true for other healthcare systems as well, but the VA shifted on a dime, mostly because it had wise centralized authority, and so that in DC they said, go take care of vets during this pandemic, and each VA system in their regionalized system was empowered to make decisions in terms of telehealth, and home visits, and management of schedules to make those decisions regionally. So they moved incredibly quickly to take excellent care of people during the pandemic. And I will say that those of you who follow New York City politics, and I don't know whether you guys at Rowan do, or Kinsey, who's out at Stony Brook, but the guy who was just not elected to be mayor of New York City, Andrew Cuomo, made some horrible decisions about nursing home care. in the state of New York, and did not report nursing home deaths, as well as asking for early discharge of hospital to nursing home. So he was sending people who were still infected to the nursing homes. So there was a big scandal about Andrew Cuomo. And the VA did very well with their nursing homes. We shifted staff. Information was shared very well. Staffing was flexible. And unlike, and again, I was closest to the New York system because I just moved back up here from New York City. The fatalities amongst veterans were proportional to population for ethnicity and region. Let me just ask, because I can't see my clock, Zachary, how are we doing on time?
We have about 7 minutes before your colleague shows up.
Thank you. And I don't necessarily expect that Suzanne will be on smack at 7. Smack at 2. So I will go through a little bit faster because I want to get to the other discussion item. I'll let you read those. So in addition to the question about the VA, and I'm about to ask a question that comes from your family and your community, but what do you think of when we say veterans or VA patients? What do you think of when I say veterans? And let me just ask you what are they like, VA veterans? What are VA patients like? Have you known any? Have you known any from the movies or TV?
I know that there's like some sort of disability process that a lot of them are on, and I think the VA is a big part of that. So that's what I
Good.
think of.
So many are disabled, and that's one of the ways that you have eligibility is if you have a disability that is service connected. And that is one of the ways that you're eligible. If you have a service-connected disability, in addition to having access to the VA, Veterans Health Administration, you also get a benefit. My hiking buddy was a Vietnam vet, and when they found out that he had hearing loss from infantry and gunfire, he actually now gets a monthly stipend. He is a highly functioning professional writer and also a first responder, but he also gets a small stipend from the VA or disability payment. So you think about veterans, some of them, and picture what a disabled veteran looks like when you say disabled. Not only might they get some compensation, but they might have hearing loss, visual loss, might have lost a limb. Other types of disability, anxiety, depression, PTSD, diabetes, cancer caused by Agent Orange. All of these things create or end up with veterans who are suffering every day because of a disability that they incurred while on the job for us. What else do you think of?
You want to go, Caitlin?
Yeah, thank you. When I think of veterans, I definitely, like you were hinting at, think traumatized, but I also think neglected, especially by the US government when they're made all of these promises and they kind of are told, they made all these promises and you're going to be seen as a war hero and you're going to get all these benefits, but then the things that you see is when I volunteered at a soup kitchen and worked closely with unhoused people. A lot of them were veterans. You can see them wearing like their army hats and clothing. And then also just even walking through a city, seeing unhoused people on the street, I feel like a lot of times they are veterans. Like you can see they have the veteran attire and the hats. So it just goes to show that they really are neglected when it's just so common in my experience to see.
Yep, Caitlin, the two biggest risk factors for being unhoused are poverty and mental illness. Um, and um, I won't ask the question, I'll answer it. The reason that many vets um, have a higher rate of poverty than non-vets is for multiple reasons. One is because they're more likely to be disabled. And the other is that they are more likely in our current system, which is what's called an all volunteer service. When I was of age, there was a draft. So even privileged people had to serve. Now, um, without a draft, the people who sign up are more likely to be low income because it is a good way to have a steady job and to gain skills. At least that is the hope. So these are people who may not be able to go to college, may not be able to afford that, or may not come from a family or a culture where that is part of the normal expectation. So they start off, and this has been studied. Veteran populations come from families of lower income than non-veterans. And so therefore, they're also more likely to be in poverty and they're more likely to have serious mental illness. So yes, they are, and then they will fall into that large basket of neglected. Thank you, Caitlin. Ariana?
I was actually going to say something very similar to Caitlin, because I have also encountered a lot of unhoused people who are also veterans. But I guess the other thing that I wanted to mention, and this goes under like the mental health umbrella, but I think the way that veterans are portrayed in like media, like TV shows and movies, shows them battling addiction, like alcoholism and other things like that.
Yep. And Ariana, any ideas about why they may be battling addiction more than non-veterans?
I think there's probably a multitude of factors, some of which you've mentioned, like being from maybe like lower socioeconomic backgrounds, maybe the trauma that they endured while like serving, but also maybe a lack of support when they come back from serving and not feeling like there's many options.
Yep. Anybody have any ideas of some, and those are all completely true, and those are probably the major drivers. I won't do the guess what I'm thinking. You also can get a lot of really cheap beer on base, and so there's just a huge amount of drinking that takes place for people in the service. And most people stop drinking heavily once they get home, but for those people who are genetically predisposed to alcohol use disorder, the heavy alcohol use during their service is often enough just to tip them over. The same thing is true for, although perhaps less so in terms of the number of people, opioid use disorder. Are there others? What do you think of when you think of veterans? Well, if any of you were a third year student, I tell you what you'd be answering. They are complicated. Um, the average outpatient veteran has almost twice as many diagnoses as the average non-veteran patient. They have more chronic diseases and they have more mental health diagnoses. And so, as a result of that, the panel size is for a doctor in the VA is less than for the non-veterans. Panel size means how many patients am I expected to take care of if I'm a full-time doctor. In the VA, it's 1,100. When I was working at Dartmouth Hitchcock, it was 1,900. So it's half again more in the non-veteran system because the VA patients, they all have hypercholesterolemia, hypertension, diabetes, obesity. I mean, I'm going to say they all. That's an exaggeration, but that's sort of the typical. Okay, well, let me move on. Are there any other hands up? Did we say veterans? Okay. So what's happening now? And the answer is that not only is the future uncertain in terms of regulations, such as I think it was Caitlin pointed out, but the underfunding that another one of you mentioned is happening in a very specific way. When there's a scandal at a hospital, and those of you who were at Phoenix at the Creighton campus may have heard about the scandal in Phoenix at the VA that the leadership was hiding the fact that veterans were having to wait too long to see a patient. And so therefore, the Mission Act was passed to give vets the option of going out to the civilian system and have the VA pay for it if wait times are too long. However, nobody bothered to study the private sector capacity. And it turns out that in Phoenix, as well as in most markets, the wait time in the private system was longer than the wait time in the VA. But what this did was begin to turn the VA into a health insurance company. And they had to set up a parallel system whereby if a veteran said, I don't want to wait to see my doc at the VA, I want to go see, my wife is being seen at the University of Arizona here at Phoenix. And I want to see her doctor and have the VA pay for it. The VA then had to set up a whole new set of bureaucracies to pay for that. And the VA could no longer monitor the care. So just like most healthcare systems, I am monitored like crazy for quality. Am I making mistakes? Am I managing diabetics well? Are my A1Cs low? Am I getting mammograms on my patients with breasts? All of these quality measures are measured by my healthcare system, by the VA. If a vet leaves my system and goes out to another system, then then VA does not get a chance to monitor that and cannot then choose which systems to permit to take care of vets with VA pay. And the next act, which is and I'm blocked here, but the Health Act changes that to say that veterans can go anywhere they want, even if there is no wait at the VA or if there is not the service available. And that's something which hasn't passed yet, this particular one, but the current VA Secretary Collins is pushing for this act. This means that the VA would go on to be just another healthcare system, taking care of far fewer veterans. In modeling of that, it will be almost impossible for the VA to provide the same comprehensive, high quality care that it has been able to do. And as a primary care doc, I will say that the system that will suffer the most is not primary care, but it's mental health. My colleagues at the psychiatry department at Dartmouth will not take me to task if I say that the best care for combat-related PTSD is at the VA. The people at Dartmouth do not take care of veterans with PTSD as well as the VA does. And arguably, because of the high rate of sexual trauma for women veterans, the skill of the practitioner of the mental health providers at the VA for sexual trauma is really been industry leading. That is most of the not most of many of the great studies on care of sexual trauma for women comes from the VA. I don't remember what the rate is of sexual trauma amongst women soldiers and sailors, but it's very high. It's upwards of 70%. So this outsourcing to private systems, which is being promoted by the American health insurance industry through their through two sources, through their industry advocacy group, which is called AHIP, and also through what are called the Veteran Service Organizations. VSOs are the American Legion, Veterans of Foreign Wars. These are organizations that speak for veterans. The current Secretary of Defense, Pete Hegseth, was the CEO of an organization called Concerned Veterans of America that posed as a veteran service organization, but was actually a organization that sought to completely defund the VA and turn VA patients and VA money over to the health insurance companies. And just as an aside, this Concerned Veterans of America was funded by the Koch brothers. And I don't know whether you've heard about the Koch brothers in other settings. But with privatization, care will no longer be coordinated well. And my study contributed to that knowledge base, where we looked at how when patients saw caregivers in the community and in the VA, there's no good communication between the two. So there was duplication of X-ray studies, missed polypharmacy, and a sense that the vets had of people not talking to each other. Not surprised. Staff will be laid off, facilities will close, and I do have to say that most civilian doctors, and I count myself as having been one before I began to work for the VA, don't know how to talk vet. Don't, in the same way that you are all, I'm sure, learning about cultural humility and learning that you may know your culture well, but you may not know the culture well of some of your patients. So you need to say, how does that work for you and your family and your community? Well, the veterans are another culture, and private sector providers have limited experience with vets. This just summarizes some of the challenges that we face, although that data is old. And if Suzanne joins us, hopefully she can give us an updated figure. But it's now obviously climbed above 44%. I'm just pulling up my phone, Zachary, so I can tell how late Suzanne is, and at some point we'll probably have to do without her. This is what I mentioned before. When we made this slide, this is before Pete Hegseth. And we already knew that Concerned Veterans for America was a danger. And they basically posed as representing veterans when they did not represent veterans. Medicare for All. Have you guys spoken about Medicare for All and National Health Program and single payer Okay, I mean, to the extent to which we look for a model for Medicare for All, as I mentioned before, it is the VA. And so therefore, AHIP, the American Hospital Insurance Programs, no, Betty, what does AHIP stand for? American Health Insurance Plans? Yes,
Yeah, I think so.
yeah. AHIP attacks the VA and the Medicare for All bills with equal ferocity. In my talk today, I have avoided talking about political parties. I am not a Democratic Party guy, but there is a dramatic there's a dramatic reality that Democrats are almost as bad as Republicans. And that's because for two reasons that this happens at Congress. One is because of the health insurance industry having spending so much money in DC that they lobby everybody. My own recent representative who lived just an hour down the road from me, and I know her family. She, when I would have talks with her about Medicare for All, she would quote to me studies from the American health insurance industry. They are so pervasive. The other reason is that veterans are a favorite I'm a good American totem. So that when the Concerned Veterans for America say, give veterans choice, let them go out into the community, everybody gets on board. Everybody, meaning all the senators and representatives, say, yes, give our veterans all the choice they want, without realizing that that meant that they were defunding, underfunding the VA, and that the care for veterans was going to suffer. And both in some of the experiments that have taken place and in modeling. So there's a strong need not to get involved in partisan politics, but a strong need for those of us who have the ear of people that we agree with on many other issues, who are more likely to be Democrats. We need to talk with them about the VA and let them know how important the VA is. And I think I'm getting to the end. So this is the same slide as I presented before. You can wake up now if your eyes were closed. It's a unique model. Did any of you look up how many, what percent of the population is are veterans? I honestly don't know. I think it was maybe it was 16%.
What percentage of like the U.S. population? Is that what you're asking?
U.S. adults.
Okay, I'll look it up right now.
Thank you. But, there is a universal healthcare system for, as I hope that you've been convinced, a vulnerable and very deserving segment of the American population. And by the way, I am a anti-war pacifist, but I do not blame the low-income people who have signed up to be soldiers and sailors. They are not the cause of war. They don't deserve to be over there killing and dying. So I am against war, but I'm not against soldiers. And if we have time, I can tell you a fun story about that. And Betty, do you know the Hatchland Farm in North Haverhill, New Hampshire?
No, I don't.
Okay, you might have known about Hatchland milk, some of the best chocolate milk available in New England. But I got into an interesting tiff with a veteran of who owns that, Howard Hatch.
Oh,
Okay, the outcomes for the patients, for families, are excellent. I've told you about some of the bureaucracy. Getting things done at the VA can make you pull your hair out. true for providers as well as patients. And yet, despite bureaucracy and inefficiency, the outcomes are superb. We are at threat from the right wing, from industry, from capitalism. And I would posit that all of you should be interested in fighting against VA privatization. So what can you do? Oh, that's me. And you can get my email from Betty or Ken or from Marvin. The first thing I want you to do is when you're on a VA clinical rotation, look at the systems, not just the clinical care. Learn what you can from how this system works in terms of what might have been Zachary, but somebody said that that the doctors have more freedom and are better supported. An organization called Veterans for Peace has formed committees all around the country called Save Our VA. Look for one of those. Think about reaching out to your congressperson. I don't know whether you're registered to vote where you currently go to school or back in your family of origin, but please, when you talk with your congresspeople, ask them to fight to privatization. The organization that Suzanne Gordon founded, the veteranspolicy.org, is a Veterans Healthcare Policy Institute, is the single best policy source of information. I want to say the reason that I know about her is that as soon as I started working at the VA, it was right at the time of the Phoenix VA scandal when they were covering up the wait times. And there was only one reporter who asked the question, what are wait times like out in the private system? Every other reporter said, oh, this is terrible. We're to support our vets being able to go into the private system. And back then in 2012, 2011, Suzanne was the only one asking those questions. And she then went on to form this organization that hires a bunch of great journalists, including Betty, including Jasper Craven, who grew up right next door to where Betty lives in northern Vermont. Suzanne wrote these two books. And the second one, Sasha is, I think, I'm not Sasha, Sasha's Jasper's brother. Jasper Craven, I think, is a co-author of Our Veterans, Winners, Losers, Friends, and Enemies. And I do believe that's it.